Hey guys, welcome to another episode of the Dr. Akash Show. My name is Dr. Akash Bajaj, and I am a triple board certified physician located in Los Angeles, California. I focus on rituals and routines to keep you resilient and robust with all aspects of your health. Now, today I want to talk to you about something we've all heard over and over how important it is, but I want to look at it from a slightly different angle, and that is exercise. Now, we've all heard why exercise is important kind of on a general, vague, non-specific level, but I want to specifically discuss today 4 particular benefits of exercise that you may or may not be aware of. I want to tell you a little bit about why exercise encourages those types of benefits. Now let's get right into it. But before we get started, if you haven't had a chance to subscribe yet, go ahead and hit that subscribe button and then like the video if you find value in it, and go ahead and share it to other like-minded people that you think can benefit from this information as well. So let's get into it. The first benefit is mental health. Now, we've all heard that exercise can improve things like anxiety, depression, and act as a general mood uplifter, which is a fantastic benefit. No question about it. But the reasoning behind that is very interesting. Now, exercise has been shown to increase neurogenesis in the hippocampus. What does this mean? This is basically just a fancy way of saying when you exercise, your brain actually starts to rewire the nerves and sometimes even create different nerve structures within a part of your brain called the hippocampus. The hippocampus is responsible for many things, but one of the most important activities of the hippocampus is emotional regulation. So this means exercise, by helping to rewire and kind of rework the nerves within your hippocampus, within that emotional regulator of your brain, can actually help with emotional regulation, emotional resilience, as well as improving cognitive resilience. Basically means you become more resilient overall, both from a cognition standpoint as well as from an emotional standpoint. Moreover, the emotional regulation component is incredibly powerful because this can allow you to just deal with the emotional ups and downs that you might be experiencing on a regular, consistent basis with a more productive and efficient system. This is one of the reasons that is thought to be why exercise can help so significantly with symptoms of anxiety and depression. Now, interestingly, exercise can also change kind of the microbiome makeup and kind of the bacteria that are noted in your gut and in your stomach area. Now, the gut is so incredibly important when creating certain hormones and certain neurotransmitters. So basically, this means that if you're exercising on a regular basis, in addition to these changes in the emotional regulating system of your brain, aka the hippocampus, you may also get a positive change in the bacterial composition of your gut and your gastrointestinal system, and this can help promote certain neurotransmitters that can further improve the cognitive resilience and emotional regulation as well. So basically, benefit number 1 here, already we've seen, wow, this is incredible. You can rewire your brain with consistent exercise, as well as change the overall makeup of your gastrointestinal system, all pointing towards a common goal of cognitive resilience and emotional regulation. Benefit number 2, exercise can improve cognitive function. Now, what does this mean? Basically, this means the more you exercise, the smarter you can potentially get. What? How does this make any sense? Well, let's talk about that. So, enhanced cognitive function has been demonstrated with exercise, specifically by improving blood flow to the brain. So, when you exercise, your blood vessels, they start to open up to allow more blood to travel through the body. That's called dilation or vasodilation, which is just a fancy way of saying the blood vessels open up a little bit. They get bigger. It's almost like a tunnel with increased need for blood or oxygen. That tunnel can actually get bigger to allow more blood through the tunnel, which will allow more oxygen to the areas that it's needed. Now, as this increased blood flow goes into the brain, this is called increased cerebral perfusion. Now, the more increased cerebral perfusion that you can obtain, the more oxygen and nutrients that get to your brain, the more likely your brain is to actually improve its function and overall ability to optimize. And don't forget, guys, your brain uses about 20% of the oxygen and nutrients in your blood at any given time. So 20% of the usage of the nutrients floating around in your blood goes straight to your brain. So it's a very hungry organ. It's an organ that requires a lot of nutrients, a lot of oxygen, and just a lot of gasoline to work well. Now, with exercise, if we can increase that time tunnel, increasing that cerebral perfusion. You're now providing higher levels of oxygen and vitamins and nutrients to your brain, which is consuming so much to begin with. You're only going to optimize the function and the ability even further. Additionally, exercise increases something in your gastrointestinal system called short chain fatty acids. Now, short chain fatty acids, they have the ability to cross into the brain. So they cross something called the blood-brain barrier. And by crossing that barrier, entering the brain, they can then act as a significant source of immediate energy and immediate consumption by the brain to continue to function at its optimal levels. So neuronal activity and cognitive function go way up with exercise for this reason as well. Number 3, weight management. Sure, we all understand if you work out and exercise, you're going to potentially lose weight. But let me explain to you why this works, and this will blow your mind as far as the other potential benefits associated here. So when you exercise, you actually increase your fat metabolism. Basically, you burn up more fat. We all understand that. But what you may not have known is the actual morphology of your adipose tissue, your fat cells, changes. You get what's called a browning of the fat. So in a previous episode, we talked about the different types of fat. Not to get too deep into that here, but basically subcutaneous fat is one type of fat. And as it gets more browned, becomes like a brown fat, that signifies an increase in mitochondrial function. And the mitochondria are like the little gas tanks in your body. They're little energy reserves. So if you're feeling low on stamina or endurance or energy, typically you want to take a look at your mitochondrial function to see what you can do to support that. Now, we do know, however, that exercise causes a browning of the fat, meaning it causes an increase in mitochondria. And that increase in these mitochondria, these little energy reserves, then helps accelerate your metabolism and further accelerate the burning of fat and just the escalation and optimization of your overall weight management. Now, we see sustained improvements in body composition and metabolism because there are also some permanent and semi-permanent changes that occur again in your gastrointestinal system that help to contribute and encourage these types of activities. Now, benefit number 4 is a decrease in chronic disease when you exercise on a regular basis. Now, we've seen that exercise can actually help decrease inflammation, reduce oxidative stress, and improve metabolic homeostasis. That basically means it just allows your body to function the way it's supposed to from a metabolic standpoint. Now, how does it do this? Well, exercise can cause a change in methylation patterns of your DNA, certain epigenetic effects, and by doing that, it can promote these types of activities. Basically, what that means is exercise can cause certain genes to turn off and on, respectively, that can promote this type of overall improved productivity and overall decrease in some of the greatest risks and precursors to chronic disease like inflammation and oxidative stress. Moreover, again, the lovely gastrointestinal system gets positively affected in this arena by changing the gut microbiome to increase certain molecules, specifically certain signaling molecules that can decrease concerning, and by doing that, it can increase immune system function as well. So your immune system will actually function better and stronger with consistent exercise programs. And all of this collectively will decrease the incidence of chronic inflammatory conditions and thereby, of course, infectious diseases as well. Now, guys, most importantly here, this is the most important part of this entire video, this entire conversation that we're having, the negative effects of exercise. And nobody ever talks about the negative effects of exercise. So I'm going to talk to you about it today. Are you ready for this? Nothing. There are no negative effects of exercise. Outside of hurting yourself and over-exercising, the literal fact of exercising within your means and within your capability, if you're regular and consistent about it, you will truly receive the 4 benefits that we talked about today with those specific mechanisms of action, and there's really no negative effect. If you ever worked out when you didn't feel like you wanted to work out and regretted it, probably not. Have you ever spoken to somebody or spoken to yourself? Have you ever noticed your own self-talk after a workout, how much it's different it is probably versus pre-workout? Have you ever noticed that? There's really science behind this, right? Not only the benefits that we talked about here today, but all of the other known benefits of exercise. Not to mention, guys, there's other huge psychological benefits that are somewhat intangible, but clearly noticed by anybody that does exercise. These are like the halo effect of exercise, right? The halo effect really applies to these other peripheral benefits that you may notice from exercise that may or may not be directly related related to the exercise. Here's an example for you. Have you ever noticed how when you exercise on a regular basis, you kind of start to eat a little bit better too? This is a halo effect, right? And consequently, the opposite is true as well. If you take a few days off in a row and you didn't necessarily intend on doing that, have you ever noticed how maybe you eat a little bit worse than you normally would otherwise? These are all related to the halo effect. The question I have for you is, what halo effect do you want to subconsciously or almost reflexively begin to absorb? And the answer to that would really determine what your next step will be. If you choose to exercise on a regular, consistent basis, you can either look at it from a cognitive standpoint, the way that I've broken it down today, where I'm exercising because of these benefits, or you can look at it from a general, overall, more spiritual, more emotional, more psychological benefit, which is simple. Hey, when I exercise, I feel better. When I don't feel good and I'm going through something, or I have a challenge laid out in front of me, if I just reflexively go exercise, if I stick to that routine, you've done a couple of things for yourself now, right? Number one, you've built a structure and a framework for your life. You have certain things now in your life there's absolute clarity about. You know, no matter what happens, I'm going to exercise. I don't really know how I'm going to deal with problem A that's just presented itself in my life, but I do know if I exercise, I'm going to stack the deck in my favor to allow myself to most likely deal with this problem in a better way. You're going to increase the odds that you are more likely to develop a solution for said problem, thereby making you more resilient by definition. In addition to that, guys, if you're going through something or you've experienced a challenge or you're experiencing a challenge, one thing so significant about exercise is it provides a positive distraction. If there's ever a day, let's say you wake up, don't necessarily have a plan in place. Maybe you have some time on your hands that you weren't necessarily planning for. You just had some time in your hands. The worst thing you can do is sit around and be idle, right? We all know this. But typically what happens if you're not really intentional with your plans in your day, you may actually begin to retract into more of a dangerous path, right? So if you're like, I don't really know what I'm going to do today and I'm not feeling so great, chances are you might engage in recreational activities that you don't necessarily want to. You might increase your levels of substance abuse or use, or just other dangerous types of activities that are non-productive and potentially going to take you down a road that's going to end up in a place you don't want to be. But if you know, hey, listen, I don't really know what I'm going to do today, but no matter what, I'm going to get my workout in. No matter what, I'm going to get that 10-minute walk in, whatever the case is for you, then at least you have some sort of scaffolding to build your day around and some sort of structure to really set yourself up towards positive distractions and towards being more productive, cognitively enhanced, greater mental health, greater physical health as well, and overall just greater self-esteem and self-confidence because of you accomplishing tasks. Now, guys, as always, we like to talk about rituals and routines to keep you resilient and robust. Rituals and routines here, I'm not going to get too much into this today. This episode is really intended to be more of a general primer, but that being said, if you've never worked out in your life, just start with something super small. Commit to yourself that you're going to walk around your block every day for 5 days. Just do that. See what happens. If you're somebody that works out on a regular basis, if you can commit to physically getting into that gym or that gym area of yours and physically just committing to get the job done, regardless of how you feel, regardless of how much weight you lifted, etc., just get the job done, you're going to notice your momentum is going to increase. You're going to become more consistent automatically. And all of these other factors with the halo effect are going to automatically begin to show themselves. And then resilience. Well, I think with this episode, guys, resilience is pretty obvious. We have scientific data backing up the fact that exercise increases cognitive resilience as well as emotional resilience. But we also know resilience simply means the ability to face a difficult task or challenge in front of you, overcome that, and move forward as quickly as possible. What can make you possibly more resilient from a physical, psychological, emotional, spiritual standpoint than moving your body and getting all of these other untoward effects? You're going to feel better. You're going to look better. People are going to notice and compliment you. These things are going to help boost your self-confidence automatically. You get the halo effect. All of these things will build a structure in your subconscious where the next time you're facing a problem or a challenge, you're probably more inclined to say to yourself, I can handle this. I've done things this difficult before. I even was able to work out every single day for the last X days against my will. There's no reason why I can't handle this said problem in front of me today. You will build that internal strength and that internal resilience. Now, of course, what we do is we can always stack upon that with other things, right? Like hormone replacement therapy, supplementation, etc. But that's a conversation for another day. The foundations and the fundamentals are the most important. step. And then finally, staying robust. Robust for our sake means the ability to stay very powerful, become the most powerful version of yourself. And just like a warrior training for a battle, if you are getting in there every single day, getting the work done, then problems that seem so overwhelming will suddenly become less and less and less so. For example, if you're working out and you start with 10-pound weights and you're doing curls, that may feel quite heavy for you in the beginning. But I guarantee you, if you stick with that activity in about a month, that 10 pounds will feel very light. That same kind of process translates into life. If problem X in your life seems so overwhelming, but you're able to put yourself through intentional pain and intentional suffering, like what we're talking about, all of a sudden that problem is not going to be so insurmountable and you will be able to deal with it, overcome it, and move forward. All of this is going to push you further and further towards becoming the best version of yourself. Because ultimately, look, you have one life to live. Nobody knows when your ticket gets stamped. So go ahead and keep that in the front of your mind when you move forward with your daily activities. And also, guys, remember, it's not like there's a shortcut. Frankly, there is no other choice. Either you pay the piper today on your own terms voluntarily by doing the things that we've talked about, knowing you're going to get all these scientifically backed benefits, or you don't. You squander your time, you squander your resources, you squander this gift of life that you've been given, and down the road, your health will catch up, and at that point, you're going to pay anyway. You're going to pay in ER visits, surgery, medical bills, medications, psychological distress, all of these things, right? There's no easy way out. There's no hack. So the choice is ultimately yours. Well, guys, I hope this episode was very helpful for you. If you found any value in this, please like this. Please subscribe to the channel as we are growing and we want to get this out to more and more like-minded people. And please share this to anybody you think may have gotten benefit. And as always, remember, the best time to start something was yesterday. The second best time is today. Don't look back tomorrow with regret. Take one small step today to get yourself maximally optimized. Thanks for tuning in to this episode of the Dr. Akash Show. This presentation is for general information purposes only, does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information and the materials linked to this presentation are at the user's own risk. The content in this presentation is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay obtaining medical advice for any medical conditions that they have, and they should seek the assistance of their healthcare professionals for such conditions.